Opioid-related overdose deaths more than tripled in Wisconsin in just 10 years.
Federal and state elected officials met today in Crosse for a public health forum, and among many topics, opioid use dominated much of today's discussion. News 8's Sarah Tamer was at that forum and joins us now in our newsroom with the story. Sarah?
Mike and Martha, more people in Wisconsin died from drug overdoses than motor vehicle crashes in 2014, and opioids contributed to 47% of the 843 drug overdoses that same year. At today's public health forum, officials discussed various policies and procedures that would go into decreasing the use of opioids in the state.
We're in an epidemic in Wisconsin.
It's a dose of reality. In the state, opioid abuse continues to be a problem.
This is not just a drug that's taken in the back alley.
Because opioids are synthetic chemicals used to help reduce physical pain, and that may be part of the problem.
Doctors were really pressured by the Center for Disease Control and society to treat pain in a better way and in a faster way.
And what was thought to be an easy fix quickly backfired.
The problem is that opioids are incredibly addictive, and patients weren't always given that warning about the incredible addictiveness.
But Wisconsin state officials are trying to do something about this alarming epidemic.
Opioid roundtable discussions that we've held 6 different listening sessions around the district, getting ideas from law enforcement, from the courts, from folks in the treatment environment.
A forum aimed at discussing a variety of statewide and local public health policies was heavily focused on taking action when it comes to issues that affect Wisconsin residents, and drugs were at the top of the list for state officials.
It's looking at national databases. We have a state prescription drug monitoring program. A national database has been brought to my attention. Also the need for regional treatment centers. That sometimes in rural Wisconsin treatment is very difficult and it is a far distance away from a community of support. Also transitional housing for folks who are going through, who are trying to get clean, and that can take upwards of a year, year and a half, and to make sure that there is affordable transitional housing for folks so that they can continue their work.
Officials also said it's important to start treating addiction as a disease in order to provide the right treatments for those who are ready to seek help.
Thanks a lot, Sarah. And Governor Walker created the Governor's Task Force on Opioid Abuse just last month. The task force is aimed to help end misuse and abuse of opioids in Wisconsin.